Project Access is a program which goal is to enhance services and access for children and youth with epilepsy. The outcome of Project Access was to enhance communication with the families through tools that we developed, through support groups that we coordinated in order to facilitate communication between the provider, whether it's a specialist or a pediatrician, with family. Creating a culturally sensitive medical home has different components. One of the things is that we always have to engage the parents and the family as a whole in getting feedback of what is that they need based on the cultural background. It's having cultural competence, having linguistic competence, looking at how families go about making decisions, healthcare decisions based on the personal beliefs, and helping the provider understand that. So the way we did it was to provide education not only for the provider and making sure that they are culturally and linguistically competent. A cultural broker is a go-to person, an individual that serves as a mediator between groups, in our case, families and healthcare providers. My role as a cultural broker with a couple of our partners that we have in Project Access was to serve as a mediator between families, parents that have a child with epilepsy, and the healthcare provider. It was beyond addressing any linguistic barriers that the families were experiencing. It was using my skills as a cultural broker to educate providers about the different cultures that the patients in the practice were part of, and also empowering and helping parents to understand the health system culture that they were part of. So it kind of, my role was bridging the gap of communication between families and healthcare providers, and learning to communicate with each other more effectively in order to enhance the care or service that the child was receiving. Reaction to Project Access was very positive. They saw that this as an opportunity for them to express what their specific providers seeking to be a culturally competent medical home is to engage parents in the decision making when it comes to what is the benefit that they're going to get out of a cultural competent medical home. Is looking at doing your own self-assessment of your cultural competence. You know, how do you perceive and work with multiple groups from different ethnicities or races. Give parents feedback of what is important to them based on their cultures, but also keep in mind not stereotyping by cultures. It's creating a system that enhances the access and open doors for families from different cultural backgrounds.